Welcome back. The Ministry of Health and Social Services is currently rolling out a nationwide polio vaccination campaign running throughout January and February, aimed at protecting children and preventing the re-emergence of this highly infectious disease. Now, to help us better understand the importance of this campaign, who it targets and how the public can participate, we're joined by Mr. Walter Skamaya, the Public Relations Officer at the Ministry of Health and Social Services. Mr. Kamai, good evening and thank you for being here.
Good evening to you too, and compliments for the new season.
Thank you. Yes, the same to you.
As well as the public that are listening to us this time around.
Thank you so much. We appreciate it. Well, to start off, Mr. Kamai, talk to us about what prompted the ministry to launch, this national polio vaccination campaign at this time.
Yes, thank you very much. The Minister of Health and Social Services detected poliovirus type 2 on the 13th of November 2025 through our routine environmental surveillance of a sewerage sample in Ndama in Rundu. To date, though, there is no case that has been registered. When we detected this poliovirus type 2 in the sewerage, and then we decided to go on a full scale of preventing the little ones that are 10 years and younger who might be more vulnerable compared to the rest of the population. So all in all, we believe as Minister of Health and Social Services that prevention is better than cure. So what prompted this is just to prevent the spread of the disease, and for us not to report or to register any case of polio, but rather to treat it well. It's still in a pond.
Well, that's great news that there's not been another case reported since the 13th of November. But for, parents, caregivers and minders of young children of the age 10 and below, what should they especially be mindful of?
Yes, to the caregivers, we would like to appeal to our caregivers all in all that as we go for the second round, this is the first round that will be starting in January. We want to appeal to them that, yes, the second round will start from the 26th to the 29th of January in all 14 regions. Well, the round 0, it was just intended for the 2 regions where it was detected. So what is expected of them is that they should know that vaccination teams will be highly mobile to ensure they reach each and every child in all 14 regions. They will be visiting households, villages, outreach, mobile sites, health facilities, open markets, shopping malls, schools, kindergartens, and community centers. So we expect our community to go out in numbers. We recognize the fact that it's a plowing season. I know some regions or in Namibia per se, we are all engaging into farming activities, but we want to appeal to the public that they should spend time and take the little ones to our vaccination sites when we start with the round 1 campaign.
So they won't be going door to door. You will have to go to these specific areas where the health professionals are.
We will go door to door. But if you have missed us, because the issue of door to door also, in case if you have missed us, please do take responsibility to see to it that you catch up with us, especially if we visit your place, you were not there. Sometimes you were at your field or the kids are at school, or maybe for some reason you did not catch up with us. Make it a point that you catch up with us. So in most cases, we'll have supervisors who will share our contact mobiles where you can call us, even maybe where you have met, you have gathered, you can reach out to us and then we can come and vaccinate. Though this polio vaccination, we did not encounter much challenges in the 2 Kavango regions that the campaign was rolled out in December. We want to appreciate and commend the region and appeal to other regions to do the same or even more to accommodate our vaccinators as they approach their areas, their villages, their household, their community, etc.
Mr. Kamaya, polio is often thought of as a disease of the past. Why is it still important to be vigilant about it today?
Yes, a disease remains a disease. So once we have reported about it, we have to be vigilant about it. We need to find ourselves at the other side where we are protected. We want to remember that maybe we last had polio maybe around 2006 or 2008, somewhere there. But it has come, as I have said or as I've indicated earlier on, that it was detected. So since it was detected, we cannot ignore. We have to be vigilant about it. We need to listen. We need to adhere to its preventive measures so that we curb its spread. So that we want to end it there before it gets spread. We want to control it.
How's the ministry going to ensure that communities in those really hard to reach places are included in this campaign?
I want to say where there is a will, there should be a way. You know, if we are willing to reach our people, we'll try by all means. Some other places that has been designated as hard to reach, we have reached out to Nampo, not in this campaign, but I just want to tackle the issue of hard places to reach. The ministry also, we are in talks sometimes. I don't want to send a signal, but it seems that one of the good is we might have our own helicopters that can make us reach the hard areas to reach. But in the past, if we talk about Opuo, where these areas they are mostly located, we have used Nampo, we have used the NDF to get to those places. So in most of the regions, we know it's a rainy season. Yes, we are looking at getting cars that can access all the places, especially the 4x4s. But for now, we haven't experienced a situation whereby we failed to reach a certain community just because where they are, it's hard to reach. We'll try to look for means. We'll try to see if it requires to take a number of days to get there. We will get there. But for now, we haven't recorded any situation where we haven't reached to a certain area to say that even floodplain areas we have reached there and then we have attended to them. So the mission, we want to assure the public that we will try by all means. I know one of the places in Palila also, we have a boat there. When we cross through Botswana, when we are there, we just call our boat and then to ferry us to the other side for us to be able to deliver the service. The Minister of Health, it's committed. We all know that it's business unusual. And then we are rising to that call.
Yeah. Well, you know, Mr. Kamaya, there's always these clusters of parents, caregivers that are a bit hesitant or have concerns about, you know, vaccinations and might say, but my child has gotten a polio vaccination already. What's the point of getting this? What message do you have for them?
Yes, the message that we have, our team, like now we are busy with the logistics. We have encountered that, so it breaks my heart. Some other people who give us refusals, they are educated people. I don't want to mention the professions because I'm not here to victimize anybody. But my office is working on a strategy that also even our team, so we are recording those reasons. So if somebody is hesitant, it means that person is not fully educated. And then we sit and reason with those people. We find out, why are you resistant? What is the root cause of the refusal for the kids not to be vaccinated? And then they will engage us. And then through that, we make time to sit with them, we educate them. And then after we have educated them, we make sure they should be one of our ambassadors who speak so high about the polio vaccination type 2 and other vaccinations that the ministry would like to roll out. It's not difficult. It's only that sometimes some people would just say, I would just say they might need one-on-one attention, and then we address it through that. And then we are also addressing this through the platforms such as this one, and then the radio, the community, the influencers, the church faith-based organization. You know, sometimes we want to admit that we cannot be influential everywhere, but when we get some places, we need to ask, how do you get things done here? And then we are also learning, and we are also teaching at the same time.
Mr. Kamaya, thank you so much for joining us this evening. It was lovely having you with us.
It was a pleasure having me. Thank you very much.
Well, that was Mr. Walter Kamaya from the Ministry of Health speaking to us about the polio vaccination campaign that the ministry is currently undertaking through the months of January and February. And they're asking all parents and caregivers to please take their children aged 10 and younger to go and get vaccinated for polio type 2. We'll be back after this very short break, and then it's time for our hot topics.